The most meaningful thing to me in this program has been being able to incorporate everything I'm learning into my work day to day. I go to a class one night and learn something about cost saving, and I'm automatically thinking about that the next day at my job. I believe that my nursing managers and mentors throughout my career really just inspired me to continue my education. They were great examples of lifelong learners.
Well, once I finished my diploma program and started working as a registered nurse, I always knew that I wanted to go back to school to get my BS degree and would like to continue on for my master's degree. And St. Luke's and Moravian had a great partnership that they facilitated that for us, so I took advantage of that right away.
I had some experience teaching vascular technology a few years back. I really enjoyed teaching, and I think there's a teacher in all of us as nurses. So and Moravian made it very easy to slide right back in.
I have a great passion for nursing and also education. I've been a nurse for many, many years and really would like to pass on some of that knowledge to student nurses.
Clinical nurse leader is a new emerging role in nursing where the clinical nurse leader has the role of coordination of care across the whole healthcare spectrum for the patient. They work in conjunction with everybody in the hospital, the physicians, the case managers, the social workers, the therapists. They do discharge planning the moment the patient gets into the hospital. They use evidence-based practice to get better outcomes for the patients. So that clinical nurse leader would be a familiar face that they see and the families can communicate with. And it really is about getting continuity of care throughout the whole hospital stay and when they leave.
The measurement of health literacy is going to be more and more important as with the nurse shortage, the health care reform, patients are going to be sent home even sooner. As a nurse educator, the challenges that I find are going to be mainly teaching the diverse population.
I think the biggest challenge that anyone going into nursing administration will have is rising healthcare costs and learning how to deal with rising costs. I think that's something that's pretty much been incorporated into every course that I've been in so far. You really have to look at cost, whether you're looking at research or whether you're looking at good leaders. Everyone really has to deal with healthcare costs.
Also the healthcare reform, I think with the nurse shortage, and nurses are going to become a lot more responsible for the care of the patients. We're also going to have to teach our students, how to deal with that.
I think some of the challenges that a clinical nurse leader will have to confront in healthcare, it's a new role that's coming out, so we're going to have to earn our acceptance by different practitioners because we'll be working with all different practitioners in the healthcare realm. Also, there's a lot of changes coming about in healthcare, and the clinical nurse leader is out there to facilitate those changes. The goal for everybody is to have better outcomes for our patients, so we're going to be doing new things and coordinating care for patients, and that's going to be a challenge for us, but I think it'll be a good one.
It's nice because Moravian offers classes at night here and over at the hospital, so that makes it very user-friendly.
Faculty is absolutely wonderful.
It's very easy to get clinical sites, which I think a lot of the places in the country have a hard time doing that.
I've taken several business courses already, and you're able to have students in the class that aren't nurses, and you're able to see things from a different perspective other than healthcare, which really do help you see the big picture. I would say to someone that doesn't think they can go back to school to look at how flexible a master's program can be. They don't have to take 3 or 4 classes at once. They can take one class at a time and get their degree completed in as long of amount of time as they need.
My classes are all on one day, so I'm able to not have to change my work schedule at all to be able to take the 2 classes per semester.
I have absolutely no interference with my work schedule.
I think that personally I'll be able to affect the changing healthcare environment because I'm getting a better understanding of how healthcare is going to be reformed and having a good understanding of what's going to happen and what you need to do when things change really puts you at the forefront of being able to make a difference.
I've had 2 classes so far, and they have really showed me that this is what I want to do.
I think throughout all the experiences I've had, I've really just wanted to become a better nursing leader, and this program has been able to offer that to me.